From the time when you were growing up as a young boy in Mexico City, what caught your interest about possibly going into medicine? How did that come about?
From the moment I was a small child, all I knew in my life was the practice of medicine. My father and my mother were both physicians. They both trained in the United States and went back to Mexico and started the practice. My mother as an anesthesiologist with my father as a surgeon, and they built up a practice with a hospital that specialized in gynecological and obstetric problems, specializing in women.
Tell me, where did you go to medical school?
I went to medical school in the National University of Mexico in Mexico City, and after I finished my studies in medical school, I came to the United States to follow my parents' footsteps about training in the United States, and took the USMLE test and started my residency, which I completed at the University of Connecticut. And following that, I did 3 years of surgery research in the VA Medical Center at Washington, D.C., and then I did a fellowship in Hand and Upper Extremity Surgery at Louisville, Kentucky, at the Kleinert Institute and University of Louisville.
During your fellowship, were you, did you stand over someone's shoulder and watch them do surgery, or were you the one in the trenches doing the surgery?
At Kleinert Institute, the fellowship is very hands-on. The surgeon would see the patient in our own emergency room at the institute, treat the patient from the moment the patient would come in the emergency room and walk him to the operating room, and one would do the surgery with the attending at the same night or the following morning, and from there we would go to clinic and dedicate a good part of the day seeing 70 to 100 patients a day in a very well organized clinic. And in the afternoon, sometimes we would have to come back to the operating room and do surgery from elective cases.
Your work, the surgery that you do it at only the Regional Hand Center? Do you do it only at hospitals? Where do you do the surgery at?
It's unique of the Regional Hand Center. We have what we like to call a one-stop shop, where a patient will come in directly from the site of injury or from the emergency room or the industrial clinic, and it will be evaluated and triaged, and then if there is an injury that needs immediate care, we have our own operating room that would be used at that particular time to perform a repair in the patient's upper extremity. And if we have a patient that can be worked up, we have our own x-rays and our own instruments that we need to perform an adequate diagnosis and eventually bring the patient to obtain treatment, either conservative or surgical.
What are the types of injuries or clinical problems that you particularly like?
Well, I like traumas from industrial injuries. I like to treat anything from a distal radius fracture to finger injuries, replantations. We do a number of those in the surgery center since we have our own microscope.
Tell us a little bit about what you enjoy using state-of-the-art wrist arthroscopic equipment to perform complex arthroscopic procedures.
When the patient comes to the to the clinic, to the Regional Hand Center, and is identified as having a wrist injury, we perform a full workup with MRIs that we request, and once it's obtained and we have a diagnosis, we have in our facility extensive materials, including arthroscopic instruments and any instrument that we might need for performing surgery at the level of the wrist or any joints, including finger joints. And with our instruments, we can go ahead and in vivo identify the pathology, document the pathology, and perform treatment either arthroscopic or open.